Okay, so we'll start now. So before we know, before we learn about how about the abnormal bleeding, it is always good to know what is normal. So what happens in a normal menses, and how much what would we say as the normal period is, and then once you understand what is normal, then it will be easy for you to detect when things go abnormal. So what is menstruation? So it's a monthly experience that all women experience. And it's basically, it's a shedding of the lining of the uterus plus blood, which happens every month in a cyclical pattern. So the menstrual blood, when you talk about it, it's not only the blood, but it comprises of the blood as well as the tissue from the lining of the womb, which is shed along with the blood. And this happens without a break, except for certain physiological situations, like when you're pregnant or when you're breastfeeding, there's no menstruation. But other than that, it happens every month, which starts from the period called menarche. Menarche is the technical term for starting the period, and it happens around the age of 12, which is on an average, it's between 9 to 15 years, but usually on an average, it's around 12 years that usually start. So if no periods happens at 16 years or above, then you should get worried and we have to check. And it's until the menstruation continues until menopause, which is another technical term used for stopping the periods. And this happens around the age of 50 in most women. And again, it can happen anything between 45 to 55. So as I said, the natural absence of periods, which is called amenorrhea, that is no menses, it is during pregnancy and breastfeeding. So other than this, women should have regular periods through their reproductive life. And the normal length of the cycle, like what we say, the menstrual cycle is around 28 days. Again, it can vary between 22 to 35 days. So 28 days, although an average, and majority of women have this. Some women normally have a period which is only 22 days, the menstrual cycle only 22 days long. So it comes every 22 days, or it could be 35 days as well. But if it is outside this range, then there could be a problem that we may need to check. And normal blood flow is around 40 to 70 milliliters, which is only like if you can imagine, it's like a half a normal teacup, or it's about 5 to 12 teaspoonfuls, which sounds like very small amount. But you have to remember, it is just the blood amount of blood that we say that is lost, but it comes with the other things like the secretions, discharge, and the cells lining the womb. So it obviously is more than this. And the length of the cycle, the period, like as such, the menses is usually around 5 days. Again, it can vary anything between 3 to 8 days. So if it is less than 3 days, that is not quite normal, but usually it happens at some stages in our life, and that could be okay. So it's usually 5 days long. So this I'm just showing like how in a menstrual cycle, what all things happen in the body. This is in a nutshell. I'm going to simplify it and just show you. And so if you talk about this is the period or the days when we bleed and the menses. And the first day it starts is counted as the day one, always when we talk about the menstrual cycle. And usually, so it ends in normally around 5 days. And after this stops, the lining of the womb is quite thin at the end of it, because it's already destroyed and shed during the bleeding. Then it starts to grow again. And at this period, the hormone called estrogen, which is released from the growing egg cell called the follicle, the egg follicle, is helping it to grow again in the next cycle. And so whatever tissue has been shed, the base of the uterus start to grow cells again. And it's coinciding with the development of this egg follicle. So The egg grows and matures to a stage for usually around 14 days in a 28-day cycle. But this length can vary depending upon the length of your menstrual cycle. The egg is released from the follicle, and this is called the ovulation. And this terminology, I think most of you might be familiar, release of the egg, which happens the middle part of the menstrual cycle. And once it releases, the level of estrogen then goes down, and there is another hormone called progesterone, which are the two important female hormones, the estrogen and the progesterone. And both are important for our normal menstrual cycle and also when you become pregnant. So at that stage, the progesterone is released from the structure, which is the, after the egg is released, the structure then becomes something called corpus luteum, and this releases the hormone. Then it changes, under the influence of this hormone, the lining of the uterus again grow, and it becomes like quite a spongy-like layer called the, here, and that phase is called the secretory phase. So this grows, and towards the end of the menstrual cycle, the amount of progesterone, this structure is then gradually destroyed, and the amount of the hormone becomes less. And when the level of estrogen and progesterone go down, that is when the menses happen. So by the end of 28 days, in a normal 28-day cycle, both the level of these hormones go down, and then the lining of the womb uterus start to shed. And the blood comes from the base of the uterus where the blood vessels are. So this is in a nutshell what happens. So if the ovulation happens, and then if there is sperm, and if the egg meets the sperm at this stage, and the fertilization, that's the early part of form of baby is formed, and then the pregnancy settles in the womb, the progesterone secretion is continuous, and then the menstruation doesn't happen, and then the pregnancy is continuing. So that's why we don't have period when we become pregnant. So that's about how naturally things happen in the body. So now let's look at what are the type of bleeding that can happen. Like most women complain that complain of it could be heavy bleeding. Some have like prolonged bleeding, that is like the days of the bleeding is more. Like instead of 5 days, it becomes 8 days or 10 days. And if you bleed throughout this period, even if the bleeding is normal, but the length of the number of days you bleed is more, that could also cause problem. So that is another type of problem. Then the third thing is the more frequent periods, and this is usually an influence of the hormones. What happens is like you get periods every 21 days or every 18 days, like that. So once you finish the bleeding after the the day one, again day 21 you're getting, that means after the period you're getting only break for 2 weeks, and then your period starts again. So that is again a very common problem. And then next one is a less frequent period. That means you're getting period like every 1-2 months, or even more, like every 3 months. And this again is mostly happening around the end of the menstrual life, like nearing menopause. This happens, and then gradually your periods stop. For these conditions, usually doesn't need treatment, but rarely in cases like if it is hormonally related, like in polycystic ovary disease, that might need treatment. I'll come to that later. Then the type of bleeding, again, less amount of bleeding. That means you're bleeding for less days. Like the amount of bleeding is much less, like you have only like spot of blood or brownish discharge. And shorter duration means less than two or like less than 3 days in duration. These two are usually okay, and that can be related to certain hormonal problems. So if it continues, like if the problem continues for more than 3 cycles, then it usually needs tests to see why it is happening. Okay, so that's about the type of bleeding patterns. So the most common is the heavy menstrual bleeding, and this in technical terms it is called menorrhagia. So it affects 1 in 3 to 5 women during their reproductive life, and especially between 35 to 49 years, it's very common. And this is because of the hormonal imbalance happening in the body at this stage. So what happens is, it could be that you're passing large clots, blood clots. So normally during menstruation, we don't pass clots. And this is because of the presence of a chemical in the menstrual blood that prevents the blood from clotting. But if the bleeding is very heavy, this chemical is, because of the heavy bleeding, the clots still form. And that is a good indication that the bleeding is heavy, because you are not able to measure what amount of blood you are losing. So we have to have certain, we have to have an idea if the bleeding is heavy or not. And this is one thing that helps us. So if you're passing large clots, like bigger than like a 10p or 1 dirham coin size, that means it is heavy bleeding. And the other sign may be that you're changing your tampons or pads very often, like hourly. I mean, it's, some women do like to change very often. That's it's a different thing. But if you're changing pads and tampons because it's getting soaked that quick, that means you're bleeding heavy. And bleeding soaking through the clothes, it's not normal. If you have protection, still it is happening, that means the bleeding could be heavy. And prolonged duration of periods, like as I said before, if the bleeding is lasting for more than 7-8 days, and you're bleeding heavy throughout these days. In normal menses, you have a heavy bleeding for the 1 or 2 days only, usually the first 2 days, then it becomes light and light. But if you're bleeding heavy for more than 5 days, that is considered as heavy. And when you lose blood, what happens in the body is that your body is in general losing more blood. And then this leads to development of a condition called anemia. So in anemia where your body is losing there is less amount of this substance called hemoglobin, which gives the blood the red color. And once you have reduced level of this, it leads to a condition called anemia, which causes make you tired. It can make you dizzy. It can make you short of breath, especially when you do your activities. And this happens because less oxygen is delivered to our tissues. So if you develop anemia, and there's no other reason for anemia other than that your periods could be heavy, that means you need treatment for the heavy periods. And that could affect your quality of life as well. So having a heavy periods, that affects the quality of life. For example, you're finding it difficult to concentrate on your job or your family matters, and you're trying to avoid activities because of this. That means you need the condition treated. Okay, so now let's look at what are the common causes, why this happens. So as I told earlier, it's a very common problem. And in majority of women, there is no serious cause that is leading to this heavy menstrual period. And this happens because of some hormonal imbalance happening in body. And this is the most common reason why the bleeding is heavy, the hormonal imbalance. And this can happen especially when a girl starts her period at menarche. This is very common, the hormonal imbalance. And this is because when you start your periods, the body's hormonal axis, what we call, it starts from the brain, a structure in the brain called the hypothalamus, and then it goes to the pituitary and then into the other structures like ovary and uterus. So this axis starts at around the puberty and then menarche. But the hormonal status is still not balanced properly in the body for the first few years in some girls. And so hence you tend to have very irregular pattern of bleeding, and it could have like a period like every 2 or 3 months, but it can be heavy. And the ovulation is not happening initially properly, so that can make the bleeding heavy for young girls who start the period. And some of them find it very painful as well. So this is normal for the girls. And nearing menopause also, like with women who are the age of above 40. And, when around this age, we call it the perimenopausal age. So it could start anything about 40, and then you could have different pattern of bleeding, and it could be heavy bleeding. Sometimes it is like a prolonged for many days, and it happens more often. So all sort of pattern I described earlier is possible in this group of women. So, but in a small number of women, the heavy bleeding could be due to another problem, which could be a problem within the uterus, or it could be that in a body's blood clotting mechanism is not normal. So, that the defect in blood clotting is a rare cause of heavy bleeding, but we do investigate, especially if the pattern is persistent, then we do investigate for these causes. So one common condition is called the von Willebrand disease. And here the blood clotting is impaired, and hence there is heavy bleeding from, like if you injure yourself, like from wounds, you can bleed heavy, and similarly you can bleed heavy during your menses as well. So if we have a history like that, we tend to investigate. And if we think there is no other, if the bleeding pattern remains prolonged, then we tend to investigate to exclude this cause. Okay. So the common reason why the bleeding can happen is called the fibroid uterus. You might have heard of this condition, and it's actually like a swelling or a lump developing within the uterus, which is a harmless one. Usually it's a harmless one. It's a very, very small chance of it having a cancerous change. And it's very common again. So the fibroid uterus is very, very common. And if the fibroid size is increasing and it is within the muscle of the uterus, then that can cause heavy periods. And it can make the periods painful as well. So this is something we'll investigate by doing an ultrasound scan of the uterus. And another not very common cause of bleeding, heavy bleeding, is infection. I mean, if you have like a temporary, one-off period which is heavy and a bit prolonged, this could be due to an infection in the vagina or the cervix. And this can be again detected by a swab test and treated with either antibiotics or other tablets. So we talked about the defect in blood clotting already. And then certain medication, if you are taking medicines to prevent the blood clotting, and this is called the anticoagulant medication. The common one we use is called the warfarin, and that can have an effect on blood clotting and make your period heavy. Okay. And the last but the most worrying cause is the precancerous or cancer changes happening in the uterus. This is a rare cause of heavy bleeding, and it's especially in women who are older. We suspect this cause when they have bleeding. And this again, to exclude this, we always advise a biopsy from the uterine lining to check for these causes when the heavy bleeding is, especially in women who are aged above 40, we exclude these conditions. And most of both these conditions can be treated effectively if we detected at the early stage. And the early stage almost cure of the cancer. So it's important for us to, get medical attention in cases if the heavy bleeding is persisting and if you have risk factors. So when you have heavy bleeding and when you go to your gynecologist, what all things are you expecting to happen? So generally the doctor will do a good, ask you for the details, especially about when did the bleeding start and the pattern of bleeding. And they will do an examination, which would include an examination, detailed examination from below, called what we call a speculum examination. An instrument similar to this, what I've shown here, is inserted inside the vagina, and they will check the neck of the womb for any problems. And they will also, at the same time, you will have, if you are suspecting infection, we will do the swabs from both from the vagina and the cervix to exclude an infection. And then if you haven't done your smear test, which is the screening test for cancer of the neck of the womb, you might do, you will be advised to have one at the same time. And this is done the international advice is that it should do smear test every 3 years until the age of 45, and then every 5 years from that. So if you haven't done one in the last 3 or 5 years, according to your age, that will be advised. Then the blood test that we often perform is for the routine blood test to check for anemia. Blood, if we suspect clotting problem, then we would advise blood clotting tests. And also thyroid function is another test that you often done in case of heavy bleeding, because it is one of the hormones that could, if the levels of thyroid hormone levels are abnormal, then that could lead to heavy bleeding. So we want to exclude that problem, because the treatment for thyroid gland problems is different. So that is another test you might be offered. So then I mentioned about the biopsy earlier from the lining of the womb, and this is to exclude the precancer or cancer of the womb, uterus. And this is done by a simple test, and depending upon where you are, like for example, I think in India, not all centers are using this tool to take a sample biopsy from the uterus. And the test usually we do is called the Pipel sampler. You can see it here actually. It's like a small, very thin plastic tube that is inserted through the neck of the womb, and then we swipe it inside the cavity and suck some cells and send it for examination. And it can be done at the time of examination itself. It doesn't need it is not very painful. But you might also be offered a DNC, like taking the proper procedure to take the sample from the lining of the womb. And that might be done under anesthesia, like putting you to sleep, but a short anesthesia. And another way we can take biopsy is called the hysteroscopy. The hysteroscopy is like a camera. We put a camera into the uterus, and we look for if there is any other causes that could cause, other conditions that could cause the bleeding. And one of such condition is called the polyps, and it is a thickening of the lining of the womb. And that can be removed at the same time when we do the hysteroscopy, like the camera test. And then we can do the biopsy also at the same time. So this has a purpose of looking into the uterus to see what is happening and then taking a biopsy. So these are the tests, and the hysteroscopy, this test can be done in the, like a clinic setting in a day, and you will go home the same day. You don't need to stay in the hospital for this procedure, usually. So these are the tests that you might be offered. And the scan, ultrasound scan is a non-invasive, like we can do this is an easy test to check for causes such as fibroids and polyps. And if you are suspecting the polyp, again thickening, that will be an internal scan that you will be offered. Okay, I hope that is clear. Then the doctor might advise you to keep a menstrual diary. So this is actually like you write down and like a calendar where you will write down the days you're bleeding and every month, so that we know if the cycles are regular or if it is prolonged or if the cycles are short. And also you can mark the days when you're bleeding heavy separately from the normal bleeding. And that helps the doctor to identify how heavy you are bleeding or your bleeding pattern, how the pattern of bleeding is, so that it helps the doctor to give you the right treatment. And then nowadays there are digital diaries available from the app. There are different apps for recording your menstrual cycle and bleeding, which can be downloaded from the App Store. So that just helps you to know, as well as the doctor, to know what's exactly is the problem. So Now, I'll just summarize how we can treat this problem. So I think there is a common belief among women that hysterectomy or removing the uterus is the treatment for heavy bleeding. And I think in olden days, yes, that was what was being done. Like if there is heavy bleeding, it almost meant that you will have to remove your uterus to cure this problem. But the story now is completely different. Hysterectomy is considered as the last resort for the heavy menstrual bleeding, and there are other effective, more methods to treat this problem. So, including the medicine, the tablets, and then other simple treatment methods, which can be done in like even in a clinic setting. Like you don't have to have a major operation for it, and some treatment can be done while you're consulting the doctor itself in the clinic, and that can give you relief from the heavy periods. So it's important for you to know what are the options available, and then you can choose whatever is suitable for you. But always we consider hysterectomy, that is removing the uterus, as the last resort, because it's a major operation and it has risks associated. So when your doctor decide about the treatment for the bleeding, we consider different factors before we offer you the treatment. So we'll check, we'll see how long the problem has been going on, and we have excluded the different causes, other possible causes, and your the desire for birth control. So whether you want to get pregnant, or you have completed your family, you wish to have birth control, or you have other medical conditions, etc. So this will help us to know what is the right treatment for you. So if we always start the treatment starting with simple medicines first, and then we see that, and for most women this works. Most women the tablets will work. So sorry, I think I have to move on. So yeah, so the tablets work in most cases. So we start with tablets that are not hormones, non-hormonal tablets, because then it will not have an effect on your cycle length, or whether it will affect on whether birth control or fertility. If you want to have children, it will not have an effect on that. And that these are quite, there are two tablets that comes under this category. And one common one, I think most of you would know, it's called mefenamic acid, or it's commonly called the Ponstan. And this acts by reducing the production of a hormone-like substance called prostaglandin, which is present while during the menstruation. And by reducing the production of this substance, the heavy periods can be controlled to some extent. Obviously, this is not going to stop it completely. This will make the bleeding a little bit less heavy, and also it reduces the amount of pain that you experience during your menstruation. So it's effective to some extent. And there is another tablet called the tranexamic acid, which actually is again effective in reducing the heaviness of the flow. And this actually helps to make the blood clot more effectively. So taking these two together actually is going to be more useful, more effective than taking one of them alone. So these tablets are to be taken during the days of bleeding, especially the days of heavy bleeding only. You don't need to continue it throughout the, after your periods, you don't need to continue it. You can stop it. So as soon as the periods start, if you start with these tablets, then it is more effective. So many women find quite good results with this. And especially if you want to avoid taking a hormone, or if you want to avoid taking the other medicines, this is the first step in the management. Now, the next group of tablets is the hormonal tablets. And the most common hormonal tablet that is prescribed for heavy bleeding is called, or irregular bleeding, is called the progesterone tablets. And it's called Primalute. I think it is a common name for this tablet. And this tablet also helps to make the periods quite regular. So, and it helps to reduce the heaviness and make it regular. So if you have a problem with the irregular periods, irregular and heavy periods, this is a good option. And this has to be taken 2 or 3 times per day. And once the heaviness is controlled, then you continue it for a total 21 days. And as soon as you stop the tablet, within 1 or 2 days, the periods will start. Also, if you forget to take the tablets, you can start bleeding. So that is something you have to keep in mind when taking this tablet. For most women, this tablet is safe, but if you have a medical condition, such as a liver condition or something, then it may not be safe. So always take this on advice of a doctor. Don't buy it from the over the counter and take it. Always take it from after consulting the gynecologist. So, and the other type of hormonal tablets that is used to treat heavy periods is the normal birth control pill, which is called the combined contraceptive pill. This is the common terminology. And it actually has both 2 hormones that I told before, the estrogen and progesterone hormone, which are the 2 female hormones. And this actually helps to make the period quite predictable, and again helps to regulate the cycle, the length of the menstrual cycle. And if you wish contraception, obviously this is your choice. But what we have to remember here is the estrogen hormone. In most of these tablets, the dose is low, but still it has the risk of the adverse risk with the estrogen is the developing blood clots in the legs, and even can go into the lungs and become serious. And so in women who are more than 35 years, or if you smoke, or if your body weight is high, this is the risk of blood clot is already high, and this tablet is not safe. So this often is prescribed for young girls at soon after menarche, especially if they have irregular periods or heavy periods affecting their day-to-day activities. Then this is an option to control the bleeding, control the bleeding and make the cycles regular. So that's about the tablets. So another measure to control heavy periods, which has become very popular in the last decade, I think it's called the Mirena coil. So if you, those who know about it, you might know that this is just like a copper T. Copper, you might have heard of copper T. It's very common, used for a birth control method that is used. So it's a T-shaped device. So you can see this like a plastic device in the shape of a T, which actually sits within the uterine cavity once inserted. You can see in the image. But the specialty with this coil is that it secretes, it has a hormone. It releases a certain amount of hormone, which is in very low quantity. And this is the progesterone hormone that I have took, it's the same type of hormone that is present in the tablets I just spoke about. And this hormone actually helps to make the lining of the uterus very thin. And that is how it works. So once it is inserted, it can remain in, you can keep it for 5 years, and the effect is, it is effective for 5 years. After that, it will have to be removed. So this is a birth control method also. So again, if you need contraception and you want to make your periods light, this is a good choice. Insertion, it can be put in the clinic. It is not a very painful procedure. So in most women, we can put it in the clinic itself. And in small number of women, if they have a difficulty in insertion, they might need anesthesia, a short anesthesia, simple anesthesia to put it in. And the only downside of this Mirena coil is that it can give you irregular periods for the first few months. Until the hormone level is balancing in your body, it can give you very frequent irregular bleeding or spotting, which you won't have a control over it. But usually after 3 to 6 months, it settles, and then it makes the period very light to the extent that in some women it almost stops and you don't get a period until this is removed. And very rarely once we put it in, it can either come out, it can come down, or it can go through the womb and go into around the womb into the abdomen, in your tummy. But that is very rare to happen, and it's not a dangerous situation, and we will be able to remove it by a simple operation. And the risk of infection with this coil is also very low. It's much less than compared to the copper T and all. So this is a very effective, considered as a very effective and second line therapy for heavy bleeding after you have tried your tablets. Okay. The other two operative methods that is available to treat heavy periods is using energy sources like microwave or thermal heat energy. And this is also becoming very popular nowadays. I think in UAE, most of the hospitals do offer it. And this is called ablation because it is destroying the cells inside the womb. And this is only suitable if you think you have completed your family, because if you get pregnant after this treatment, it's associated with a lot of problems. So you have to make sure that you go for this treatment only if you're 100% sure you are not going to get pregnant again. And this is not a contraception. So if you have done this, you have to use another contraceptive measure to not to get pregnant as well. And this again is a simple operative procedure which can be done in a day, and then you are discharged from the same day itself. And considering the effectiveness, this is also an effective method. But what we find is, in general, after a few years, the effect start to come down, and the women might start to bleed again. But again, saying that this going through this procedure avoids major surgery, and if it is effective. So it's called either thermal ablation or microwave. It's not that popular. Thermal ablation is very popular. So if you have other causes like polyps, as I told earlier, the thickening of the lining of the womb, that can be removed by the procedure called the hysterectomy, which is like putting a camera into the uterus and removing the polyp. And if you have a fibroid that is causing the problem with the heavy periods, then removal of the fibroid may be required. And this can be done either by a laparoscopy, which is a keyhole surgery, or if it is a very big fibroid, I have multiple fibroids, you may need an open surgery to remove the fibroids. Especially if you are considering a pregnancy, you want to preserve your uterus, but you have a big fibroid that is causing problem, then you have to remove the fibroid alone to stop the heavy periods. So now coming to the last resort, which is a hysterectomy. So it's a permanent remedy for the heavy bleeding by removing the uterus. And there are different ways how we can remove the uterus. Nowadays, the keyhole surgery is very popular. So by laparoscopic hysterectomy is available, I think, almost everywhere now. And it is, and the other method is the vaginal, because by removing the uterus from below, which avoids a cut in your tummy. So there is no cut in your tummy. And both these methods, the benefit is that you don't need a prolonged period of rest afterwards. And the recovery is quite fast compared to the proper operation to remove the uterus by making a cut in the tummy. That is a major operation. And hence, I think these two methods has become very popular nowadays. And most women, these methods are suitable to remove the uterus. But if you have a very large fibroid that is causing the heavy periods. And when we talk about removing the uterus in such cases, you may need an open operation. And the hysterectomy is, as I said, it's a major operation, and it has the risk of a major surgery that we see, like infection, bleeding, and damage to the nearby organs like the bladder and bowels. But in most cases, it is a straightforward procedure. So if all the measures are not working and you continue to having periods, and this is the ultimate answer, and you might need to go for it if the other treatment is not working. But we always offer the other methods first before we go for this one. And nowadays, the hysterectomy rate of the number of women having this procedure to stop heavy bleeding is coming down because we have these other options. Okay. So that is all about the abnormal bleeding that happens during the periods. And if the hormonal, I told about the hormonal problems that cause abnormal bleeding. And one common condition is called the polycystic ovary disease. And this is very common hormonal problem happening in women. And it is not a disease, actually. It's like a situation where the hormonal hormones in the body is imbalanced. But it can be corrected by doing a lot of lifestyle measures. But the main issue with the polycystic ovary disease is that it can give you abnormal bleeding, abnormal periods, such as heavy periods, or very common to have irregular periods, and especially less frequent periods, like you have a period every 2 or 3 months, but when it comes, it is quite heavy. So once you see your doctor, they will offer a test to confirm the condition, like blood test and scan, and then treatment. But in general, if you need to have a period every 3 months so that the lining of the womb doesn't grow uncontrolled, which can then lead to a precancerous changes in the uterus. So if you don't have periods more than 3 months, you should go and see the doctor, and they will offer you a hormonal tablet, which is same as the one we discussed before, the progesterone, which once you take it and then you stop, then the bleeding will happen. So, every 3 months at least, we have to have a period to remove the lining of the womb. So the two other bleeding pattern problems that I wish to mention today is about the bleeding in between. This is not related to the periods. Actually, the bleeding here is happening without any relation to your periods, and that's bleeding in between the periods. So if you had a period, then you stop bleeding completely, and then in between you have like even mild spotting. You just see spot of blood for 1 or 2 days or few days sometimes, and then it stops again, and then your period starts after a few days. So this is called the intermenstrual bleeding. So it's happening in between the periods. And another problem is the bleeding happening after sex. It could be range from mild spots, or it can be quite significant as well. So these two symptoms need a quick attention, because this is not normal. And this although it can happen in the first problem can happen when your hormone with some hormonal imbalance, but there are more other reasons that could cause this, like especially the cancer of the womb or the cervix. So it's important for you to go and see your doctor when this is persisting for more than 1 or 2 periods if you have this problem that is not normal. And if the doctor will do the tests to exclude if you have any of these conditions. So that's all about the abnormal bleeding today. So these are the 2 websites, the NHS UK and CDC website, that you can refer for more information. But I'm happy to answer any questions that you may have. So if you have any questions, you can either raise your hands or put it in the chat box, please. Thank you. I'll stop this. Hello, anyone, any questions? So one question that was here is about what tablets is suggested for heavy pain during menstrual period. So the answer is we usually give the mefenamic acid, which helps with the pain, but you have to start it at the beginning of the period. If you're regularly experiencing pain, you have to start it just at the beginning of the period and take it regularly of the days when you have pain to have the maximum effectiveness. Okay, anyone, any other questions? If you don't want to ask in person, then you can type it here. So I'm just going through the chat box. So somebody asked about like bleeding happening after sex. If you have done all the tests and and everything is normal, you don't need to worry about it. But there is certain reason why you are bleeding. So that can be treated by a simple treatment, like burning the neck of the outside of the neck of the womb, which is bleeding. So that can be done to stop it. But if all the tests are negative, and then you don't need to worry much unless the bleeding is changing. If it becomes more heavy, then you probably need to go back to the doctors. Okay, any other questions? Okay, I have got a hand raised here. So is that Najla, you want to ask question? Can you unmute yourself? Hello, Najla. Okay, that is. Okay, so any more questions? So I think we are coming to the end of the program. So if any more questions, I'm happy to answer. If anyone want to ask, just raise your hands and then you can unmute your mic and then just ask any questions that you have. Okay, I think that's it. Thank you everyone for attending, and I hope we'll have more webinars in future on different topics related to female health as well as the other topics in general. And we'll keep you posted with these in the coming weeks. But thank you very much for attending today and supporting us. And hope you all have a great week ahead in 2022. Thank you.